This is A Silent War Within, the podcast dedicated to confronting the unseen mental health battles carried by our first responder and healthcare heroes. This show is about real stories, real struggles, and real ways to survive the storm and come out stronger on the other side. For too long, stigma has kept you silent, but this is your space to bravely break that silence, share vital insights, and build a community where your well-being truly comes first, because your service deserves unwavering support.
Hey everybody, welcome to A Silent War Within. My name is Michaela. I'm the co-host. We have Kevin Witzel here with us today. He is our host. And then we have the beautiful Miss Andrea Law here today. How are you guys? I'm so excited
Oh,
for this
great. Thank
episode
you so
because
much for
I don't
having
think I've
me.
gotten to interview another registered nurse. So I'm really excited. So just for the
Definitely.
podcast,
Very
you can
excited.
find us anywhere you listen to podcast, Apple Music, Spotify, also at asilentwarwithin.com. Oh,
Thank
YouTube,
you, as
yes.
well as YouTube. Don't
You can
forget
see our
YouTube.
lovely faces.
Yeah, we actually have
I saw
yeah,
that,
well,
yeah.
Spotify has us on video now too.
Fancy.
Yeah, so now we're fancy. Now we're real fancy. Andrea, I have followed your content for a very long time. I love that you're an advocate for EMS. I love everything that you've been doing on your platform. I love that you give away your PR packages. I haven't won yet, but whatever. I haven't been chosen. Yeah, keep trying. That's right. But tell us where you come from. Tell us your origin story. Tell us kind of how you got to be home health nurse and then what changed in there somewhere to create this EMS following that you now have.
Yeah, absolutely. So I kind of came from a family where there's a lot of medical people. My grandfather was a veterinarian. My dad, coming out of the Air Force, worked in hospitals. And so we were raised in that type of a atmosphere and a lifestyle. We would go visit dad at the lab, at work, at the hospital. So we're kind of just accustomed to that. But I had no interest in working in a hospital coming out of high school. I actually wanted to be either working in business or a psychiatrist, ironically. And so when I had graduated, my parents were trying to talk me into nursing, like trying to sell it. Like, there's great job security. You can go anywhere. It's a great career. It's great pay, all these different things. And part of that was because my mom, when she was younger, was going to go to nursing school, and because she got pregnant, she ended up, not doing that. So there's kind of like that strong thread of the medical industry and support for nursing. And so I was like, nah, I'm going to go get my psych degree. So I went and I got my psych degree. And then I realized you don't really make very much money in psych. There's not a lot that you can do without, having a doctorate level of education. And
Mhm.
so I'm like, all right, so I'll go into business. And I absolutely loved business and did really well in business. And I helped a lot of people. For a while, I was the COO for the Better Business Bureau. And so you kind of got to help people that were struggling in a certain type of sense where they weren't getting a lot of help with an issue that they had with a business. But I still felt like there was something missing. And it was really hard to move up any more than I did being a mid-20s female without having a higher level of education. Because at that point, I had a psych degree that doesn't do really much of anything in business for you. So kind of was looking into maybe going into being a psychiatrist, but that was going to be really expensive because medical school. So I thought, well, let me go to nursing because, maybe my parents were right, 5, 10 years ago. Maybe I should try that. That actually is sounding interesting now. So got into nursing in my late 20s, early 30s. And at the time, it was funny because trying to convince me to go into nursing, my mom convinced herself to go back into nursing. So in between that time, she went back to nursing school. My dad also went to nursing school. And so finishing nursing school, my mom primarily was in home health. And I loved the flexibility, and the relationship that you could build with the patient that you couldn't in a lot of other settings, and the ability to the earning potential, and in by the point that I graduated, I was kind of in a situation where it's like, okay, I'm going to have to be a primary breadwinner. So that really kind of came into play. So moving into home health, that was a little bit rocky because it is hard for essentially a new grad to do something with so much autonomy. So that was definitely a journey, but I quickly, you know, did everything I could to stand out, which I try to do in everything. Became the assistant director of nursing and then the director of nursing for the facility for several years before going back for my master's. And at that point, I went back into the field, which I just absolutely love. It's so hard to pull me out of the field for very long. And so that kind of brought me to this point, and I've just, sought further education as far as wound and ostomy management, which I just have absolutely loved learning about. So that kind of brings me to
So, Andrea, how
where
long
I'm
did
at
you work in the
today.
hospital for? Oh, you didn't. You went straight
So
out.
I didn't actually.
Oh, really?
I had 6 months of like my preceptorship in the ED at the hospital that I love here so much, and had such a great experience. I'm sure we'll talk a little bit more about that. But I essentially went into home health, which is very rare and it's kind of
Hmm.
controversial. A lot of people don't necessarily think that that's a great idea, and it depends a lot upon skills and attributes that a person has, completely unrelated to nursing. But
I've
yeah,
never
essentially
heard
went
of a
straight
nurse
into
doing
home
that. I'm
health.
sure that was a really hard transition from nursing school because in nursing school, they kind of prepare you to work in the big box hospital, you know? That's like the whole focus. So, from working just that short amount of time in the ER to then transitioning to home health, what did you what are the primary things that you noticed that were different?
Nursing school is such a control bubble that you're in, and there it is a culture shock, I think, going into any place, being actually employed, but then more so in home health. And I think that some of the biggest culture shocks was that there are some people out here that they do not even care to try to do a good job. They do not care if you, the patient, or anybody lives or dies. And so it's important to identify who is really there to help you, who can be a support system to you, and who maybe you shouldn't go to kind of find that essential support system to help you succeed. Because I think a lot of new grad nurses in any setting don't do that to the point that they need, and they fail, and or they leave, they move to another career because
Yeah, I
they
was
just
just
have not
thinking
found
about
the
that while
support
you were
that they need.
talking. In nursing,
Hmm.
when you go to a hospital, you're surrounded by hundreds of nurses every day, the offgoing shift, the ongoing shift. See if you have questions or learning opportunities, other people are there. How is that like being a new grad at homes by yourself, doing medical procedures by yourself?
It was crazy in the beginning there's not a lot of training in home health. There's very little training actually, because it's really built for a nurse that has more experience. But I think because in a sense I didn't know better, and because my personality type, that's all I know. And I didn't really realize that there was such a big contrast until I was a director hiring nurses, even from like an emergency department, who would, go out on a visit and just like wig out. The anxiety would overcome them because they just felt like, I'm here alone. I don't know what to do. This is happening. Who do I call, or what happens? I don't have the charge nurse here and other nurses to help me turn or lift this patient, to do the wound care or what have you. So in a sense, I feel like that probably was almost an advantage, because that's just how I learn. That's all I know. All I know is that I have to depend in that immediate moment, in that setting, completely on myself. So I think in a way that kind of helped me
And plus, when
become
you're
a
in nursing
stronger
school and then
clinician.
you go work in the ER for a little bit, that's kind of like a sterile type environment. And then you're going to people's houses. I know that can be challenging. You're doing wound care on a bed, that might not be as clean as at the hospital.
Uh, Absolutely. It's like night and day. And I think one of the biggest things that facility based clinicians don't necessarily know the impact of what the setting can have, compared to like a home health nursing or something like an EMS situation. It's hard to, when you haven't experienced it, understand how your
Yeah,
environment
so a
impacts
lot
what
of
you
your
do.
content that you put out is about like fostering that positive communication between like nurses, healthcare workers, and EMS. Talk a little bit about that.
Yeah, absolutely. There was kind of an initial post that got me into EMS talk, so to speak. And it was based on an experience that I had in a home health setting. And I just had received an overwhelming support of people just willing to open up and share their experiences and in a completely non-judgmental, open, accepting way. And it's funny because the post was about a situation where I had this patient and I had to call 911 and I'm giving a report. And he asked me, I think it was like I'm in the middle of the report and it was completely unrelated. And the person asked, they're like, are they on any beta blockers? Like, I don't know. I'm like, I don't know. How does this? And I'm like doing mental Olympics trying to figure out how does that, what am I missing? Cause I'm pretty neurotic and I didn't know the answer and that really bothered me. And so I'm like just stewing on it. And I think the next day, I made this post. I'm driving and just pull over and I'm like, okay, what do you want and in what order? Like, I need to know because I need to have all the answers for you because I'm just neurotic like that. And it's funny because every time I would call, for the ambulance and you guys would show up and you're like so tough and cool and this and that. And so I felt like I kind of had to have a certain presentation in that post for people to like not like eat me up, I guess, like, in a sense of like toughness. And so I realized after the fact that like, wow, these are like actually nice people. Like I think there was a bunch of people who had stitched it. And I think one of the earlier ones was Shade Tree Cardiology. And he's like, no, actually, like if like you're there when we arrive, like that's great. That's a good start. But also like if you gave all these things like, hey, it sounds like you're actually doing the right thing. And it was really nice. And I was like, oh wow. He was like really nice. And I was like, I have 1,001 more questions to ask. So I'm just going to keep poking the bear until I get eaten alive. And so I just kept asking, all the questions that I kind of like accumulated in my mind in having, other interactions to learn and better understand that side of
Yeah,
healthcare. So
just
that's been
so
really
you
fun.
know, hospital nurses think home health nurses are like superheroes because you know this. When we send people
Oh,
home from
really?
the hospital, they're not ready to go home. Not most of the time. They need PT, they need OT, they still need speech therapy, they still need an aide to come help them. So we think that y'all are just the goddesses of healthcare, to be quite honest.
We appreciate that. And we have so much respect for the hospital nurses as well. I mean, it more so now than ever, what you're saying is so true. I think with the change in CMS from, we have PD or PDGM, I think the hospital's PDPM, the model, it just pushes out a higher acuity patient anymore. And so it used to be 10 years ago where these patients are pretty chill and I only have to call 911 like once every 6 months. And now I'm like, why am I calling 911 every week now? Like, just the patients are really higher acuity
So
than
that
they
brings me
really
to a
ever
good
have
point.
been.
Home health nursing is not all sunshine and rainbows. And what are some things in your personal opinion, or what have you dealt with that's related to burnout? So, like PTSD, things like that in your career.
I think a lot of it is kind of related to my experience in observing home health nurses and, management role or just as a peer, taking on more emotionally and physically than you should have to, kind of becoming like it just takes over your identity. And especially in home health nursing, you take your work home unless you really have healthy boundaries. And so a lot of nurses will have patients call them, or even myself included when I started. If you're having any issues, call me. I don't care day or night. And patients would definitely take advantage of that. And they're calling you at 3 a.m. to find out, what's the best laxative to take or just random stuff, and it really wears on you the expectations of admin, the demand of the patients, kind of that compassion fatigue. But then, like moral injury is kind of like a new buzzword that I'm really starting to learn more about. And I think that that's a huge contributing factor to that burnout. And I think that a lot of, especially private entities, whether it's hospitals or home health, the they're really trying to get as much out of you as possible. And I don't necessarily even believe that there's a nursing shortage. I think there's just a shortage of nurses willing to do what you want them to do. I think that there's plenty of nurses that would do, something for a fair amount. Just like think about EMS. How many more paramedics and EMTs would we have if it was more adequately, paid, their compensation was more appropriate for what they're doing, there would be so much more. There wouldn't be a shortage of it. So I think a lot of those things contribute to that type of burnout.
That's one of Michaela's hot takes. She loves a good hot take. When she did her episode with us, we had to do a two-parter because she had so many hot takes. And
Uh-huh.
as you can tell, she's pretty
Thanks,
wordy
Kevin. But
most
I
of the
am. That's
time.
true.
Yeah. Yeah. So one of the things that in my practice as a paramedic over the last years, I have had both negative and positive experiences with home health. The negative experiences are the home health nurses that don't have any information, that don't know what the patient is on, doesn't know what happened with the patient in the hours preceding, me getting there. So I've had both, and I have a few home health nurses that I'm friends with today because we met on a scene and they were so good at their job, and you just get that feeling that, man, these guys are on it. And it is, there's such a close connection that I don't think we put enough thought into. We go into houses in emergency situations. You guys are also going into houses experiencing the same kind of environment that we are, some that may or may not have family members there that are unsafe and unsavory folks. That's kind of the environment that we both live in, but we don't realize how close that's connected. Sometimes we in EMS can really get tough on nurses in general. One of the things that I love about what you've done is you started to kind of bridge that gap, and you kind of talked about where the pivot happened, but let's really get down to brass tacks, if you will. For decades, we've kind of been, nursing and EMS have kind of been unofficial arch enemies. It's just kind of, and a lot of that comes from, we deliver to the ER who's chronically understaffed, overpopulated, all those buzzwords that we can use to describe the ER. And you get nurses who are just naturally burnt out and will say, why'd you bring the patient here? They don't need to come. It's 3 a.m., like all those things. So it kind of has developed this unnecessary rivalry almost between nurses. And one of the things that I think you've done well is kind of bridge that. So what do you think fueled that lack of respect or that lack of trust between the two entities in healthcare?
Yeah, thank you. That's a great question. I think it is rooted in two things. One, a lack of understanding of what each person's role is, but also kind of the rules behind it, the bureaucracy behind it. Why you actually did bring them there. Because they don't necessarily in the ED understand that you kind of have to bring in there, what your facility policies are, what the liability is when you show up on scene. If you're not going to talk somebody out of going, even if you think that they don't necessarily need it because of a lot of different reasons. So I think a lot of it is rooted in a lack of understanding. And for I think a lot of people, if they had that understanding, they would have a change of mindset. Some people just don't want to change. They don't care to know. They don't care to learn. And those people we can't really help. But for I think the vast majority of people, if you just expose them to the information, whether it's on a ride along, which I'm sure we'll definitely talk a little bit about, I think that they would have a much better understanding of those things. And then the second thing is just respect. There should always be a minimum level of respect, really, in every interaction between every two people in any type of setting. And I think sometimes that does slip. And we do make mistakes, and it's important. I mean, I've been in situations where I come back after the fact and say, hey, I messed up. And if I messed up in public and did something to make you look a certain way, I'm going to apologize in public, because I think that that's the appropriate way to do that. But just to recognize our own faults and to kind of come to people and say, hey, I didn't understand this or I reacted poorly, and just have that basic level of respect for people is really important.
How did you gain the level of respect that you have for EMS? Was it the desire for knowledge, or was it more that you've had a situation where you've seen us have to come in and perform something that was maybe outside of what you're used to seeing, and you go, wow, these guys are something big? Because, and I don't say that from a toxic place and saying that I'm some superhero, but there is, paramedics and EMS in general do some things that the general public are just awed by sometimes. To us, it's a normal Tuesday afternoon. It's not a big deal. But the general public tends to be awed by some of the things that we do. So did you see something like that, or was it just the desire to have more knowledge and be more prepared that made you such a friend of EMS now?
That's a great question. I think there's kind of pinpoints along my whole life that kind of contributed to a web of that. I think in my family, we grew up with there was just always a level of respect, kind of along the same lines of military, where people are making these huge sacrifices that we can't even comprehend to provide the availability of a service that you hope you never need. But when you do, you certainly really appreciate that. There have been kind of experiences here and there where, EMS or fire or police have had to respond to certain situations that kind of help to integrate that web of respect and kind of piquing interest of wanting to know a little bit more about it. And then just coming into EMS TikTok and getting to know the people behind it, what their stories are, what brought them to where they are, the challenges they have, and what they actually do, what the sacrifices really are that we don't understand, that we take for granted every day. I'm like astonished sometimes that people will do what they do, but I'm certainly grateful for that. So I think it just kind of, in my whole life, there's just been points and reasons that would just support having that level of respect and interest. And so it just, as I learn more and I'm exposed more, it just makes me more curious and more interested to learn more about it and support the people
Andrea,
behind
Kevin,
it.
I know you're not done with your part yet. I
I
just do have a question. Did you have like a really bad interaction with EMS? I
Yeah.
know you talked about the one, but was it ever like an argument in front of the patient type of thing that, you got there, they got there and they were arguing with you or whatever?
well, I've been through that.
You know what? Not really. And actually, when I was in the ED for that 6 months at the hospital here in Las Vegas, there was such a great relationship with EMS and the nursing staff, whether it was a hospital based uh, staff or whether it was the ones coming in. They just have such a great relationship. And like the nurses just like cherish, like if you needed an IV starter, if you needed this or that, like they're the go. Like you go to these people. And when they would come in, there was so much respect. So I didn't even necessarily know that there was kind of that like rift between EMS and nursing until really I got into EMS TikTok and I'm learning like, well, what do you mean I'm good because I'm still on scene when you arrive? Like, what are you talking about? You show up, people aren't here. Tell me more. And just hearing all of the kind of like stereotypical, things that happen, it just blew my mind because like I've never experienced that. Even as a manager, people leaving and not being on scene or saying certain things or the cliche like, oh, this isn't my patient or I just got here, like which may or may not be true in a situation, kind of those cliches. So wasn't even really necessarily aware of that rift until we're, getting into EMS TikTok, but then seeing, videos that came up from nurses that or other disciplines that were just totally saying something out of complete ignorance. And it's like, dude, you like don't even know. Like, why wouldn't you just come on here and just ask the question? Like I could have come on and ranted and raved that the guy made me look like an idiot because I'm like, I don't know if they're on beta blockers. Give me 12 seconds and I'll look it up. But I just wanted to ask the question. And so I think, there's this and I have a master's degree. It's irrelevant. Like, so it's not saying I'm stupid. I need to be angry that somebody treated me disrespectfully. Anyone at any level of experience or education can come on and just ask a question to anybody. And so I think that sometimes just seeing that approach from people not in EMS, like just triggered me in the worst way. And it was like I have turned into like this almost mama bear-esque persona in some situations where people call me like the EMS mom just for that reason. Like, I'm kind of like, wait, hold up, nurse nerd. Like, well, what are you talking about? Like, let's take a step back and reevaluate the situation and break it down. And maybe we can all learn from it.
Kevin, do you
But
want to tell
respect
your
always
story
has to be.
And you even
about the
Yeah.
which
argument with
one?
the
There's so many.
nurses? Just so people know the actual rift that goes on.
You
Oh,
actually have to be more
I can
specific.
tell
There's
you
been
for
numerous
sure because I work down
arguments
in
with
the ER
nurses.
sometimes at the hospital that I'm at. And when they call over the radio, what you don't hear come over the line is that is such a stupid reason for them to be bringing them here. Or like, you don't put a tourniquet on a venous
mhm.
bleed, things like that. You're like, oh God.
Yeah. Yeah, I've had numerous experiences with both nurses and doctors and multiple other disciplines that I could name off that really, and I don't remember what story you're talking about, Michaela, but I can tell you I had a very bad, I was probably had been a medic for 2 or 3 years and went to a very traumatic accident. It's raining. As I'm getting there, the fire chief for the town I was working in runs by me and said, "You got to get down to that car. That kid's dying." And there was multiple patients. So my EMT goes one way and I go the other way to the kid that is said to be dying. And I get there, and by God, if the fire chief was not absolutely correct, he was actively dying. He was doing the little guppy breaths, like he was not in a good spot. And they're trying to peel the car off of him because this is a crushed car. He's entrapped. And I told him, I said, screw his legs. I said, his legs are trapped. I said, I don't care if we have to rip them off. We have to get him out, life over limb at this point. So I get him out. My partner, who has been an EMT maybe 3 weeks, looks at me and goes, "Wow, this is going to be cool. I've never run lights to the hospital." I was like, oh, gosh. So he starts, and we're going up the interstate. This was in central Mississippi. We were going to Memphis, so it's about a 30-minute drive up I-55. And I get probably 20 minutes from the level 1 trauma center, and I call report, and the patient is actively beginning to have softer blood pressures. He's starting to crash. And they said, "You need to divert to the closest medical facility." Well, I was a newer paramedic and had dealt with my fair share, but anything that the level 1 trauma center, this was a nurse answering the radio. And so I listened to her and I went to the local hospital and they had him transferred out in 10 minutes after I got there. Like it was just a useless stop. They hung blood and just went on. So the next time that I had a similar situation where I worked a bad wreck and the patient needed to go to the level 1 trauma center, they tried to do the same thing again. And I said, "No, ma'am, you're the telephone answer. I'll be there in 10 minutes and we'll see you in Trauma Bay 1, and they were all upset, obviously, because I had pushed some buttons by saying that. But it's stuff like that, and it's the cliche things that you mentioned, and I've heard that. We go into nursing homes, especially, this is where you find this the most at. It's, "I don't know, I just got here, it's not my patient," like all those cliche things. But I really think that what it boils down to, where the disrespect starts to happen, is that nurses, doctors, and you have a different viewpoint on this, and you've spoken on it a few times. I don't think that our environment is understood. I think we're put in the same bubble as they are, and we're healthcare, but we do work in uncontrolled environments. Like we mentioned, we work with some unsavory people sometimes. We work with some of society's worst. And there's a big emotional toll that goes into what we do that I think is commonly misunderstood, because when the hospital sees them, they're packaged up. They're in a nice little bundle for them.
Yeah.
We're walking into the scene that's bloody and nasty and just, could be very traumatic to see. And by the time we've got them there, typically there's a lot that's been done in that time frame. So I think that people overlook the emotional toll. And I love that you have touched on that numerous times on your platform.
Definitely. I think that the emotional toll is so important, and mental health cannot be put to the forefront enough. I think it never cannot be talked about. It's so important.
Yeah.
You talked a lot on your social media about like fostering that, positive environment between like the home health nurses and EMS. And just following up on that, what do you think from learning what you've learned on your social media? What do you think are 2 things or 3 things that nurses could do to foster that positive relationship, like when EMS shows up? What have you learned from that?
I think that it starts way before that. It starts with understanding the role of those individuals. And I think that um, something I'm trying to do myself is go on a ride along and try to be the fly on the wall and try to experience what that's actually like, so that it will help to prepare you to understand where they're coming from, but then anticipate the information that they're going to need, because you saw it, followed through from the beginning when they got the call to dispatch, how it was transferred to them getting there, all the way to the handoff to the hospital. I think that would help, especially in a home health setting, help the nurse to understand what information that they need. Or even in like a facility setting, when they hand you guys the folder and say, "Here you go, boom, bye." Well, you guys are going to have to give reports soon. I think that it's important. It's important to understand and anticipate what those needs are going to be. So I'm a huge supporter of any and all nurses, regardless of what field they're working in, to go on a ride along, to seek to understand what the impact is and how we can better
Yeah.
work together. So I think that's, and then also, again, just, underlining respect. When you don't understand, trust that somebody probably knows how to do their job. I mean, unless it's like a critical, life threatening situation, like Kevin was talking about, you kind of just pull that card sometimes if you feel like it's going to, it's life and death. But outside of that, like, you can just trust somebody that they probably, know how to do their job and provide that they can let them take over. Because in home health, I know I'm not the boss anymore. I'm not in control of the situation when they arrive. Now this is their scene. I'm going to be the person providing information that they ask for, that they need, but they are in control now. That's their scene, in my opinion. And that's how I took it when I was a director.
I want to
So
break in here for a minute because I think that works both ways because, like, and a lot of this, because it's a first responder healthcare podcast, focuses a lot on the relationship between nurses and EMS, but that flows the back way too. Like there is a lot of misunderstandings about the jobs of nursing and what they do. I can remember I'm married to a nurse, and when my wife and I first got married, there was a constant back and forth that happened. And I always, still today, pick on her. I says that our tags for our cars, the nursing tag for Mississippi says nurses touch lives. And the tag for EMS for Mississippi said EMS saves lives. And I would always shoot it back at her. I was like, you keep touching lives and I'll
Do you know
keep
what
saving
Dylan
them.
said when I
You
had that
just don't
tag?
worry
I'm
about
sorry to jump
anything.
in, Kevin. He said the way I drive, it should say nurses take lives.
Well, I've been in a car
Hush.
with you, and that's actually pretty accurate. So I don't disagree with that.
Shots fired.
But going back just a bit, and it really relates to what you talked about, like, yes, EMS has an emotional toll, but nursing also has an emotional toll. Like there's a huge part, and especially with home health nurses, I couldn't do it. And the reason that I couldn't do it personally is because you guys have so much time to get connected to patients and their families. If one of them passes away and dies, my
When
watch is always talking.
It's the third
I'm
co-host.
gonna start taking it off every podcast. But yeah, it is. You're right. It's the third co-host. But yeah, I just couldn't handle that close relationship you guys build. Can you speak to that a little bit and how that may have emotionally impacted you over the years? Because I'm sure over the years you've had some of these situations arise where a patient did not do well.
extensively to that point, it's a good and bad thing. It's something that drew me to the field, that you could get connected with somebody and help them on a deeper level that you can't unless you build that rapport with them. So in a way, it's a good thing for the nurse and for the patient. But when they are suffering, or when there's things that they need that you can't necessarily provide, it really does kind of put you in a certain situation. You do definitely have feelings about that. But not if, but when you lose one, that is really challenging. And there's not really in home health any, type of program to really help you cope with that. There's no, like, who are you debriefing with? The wall? Like, nobody's there with you. They don't really know the patient. And sometimes, there'll be a text and a Teams or whatever, type or text that, oh, unfortunately we lost this patient. And it's like, oh, for the people who know them all, may they rest in peace, or, they give kind words. But when you get so connected, it is so hard. And I have lost a couple patients in a relatively short period of time that just, like, in the moment, just like break you. And you're just, especially when you're not necessarily prepared for it. And even the patient's family, I have a patient who is elderly, and I mean, I kind of maybe would have been prepared if something happened to the patient, but when when it's the patient's family member and you see the patient just broken, like, you're broken too. You're sitting there crying with them. I had another patient that I must have seen him for over a year doing wound care, and it was like we were on like the last couple visits before his discharge when he was hit in a hit and run and just left to die in the gutter. Like, to be, it's just awful. And so seeing that on TV and just learning about it from, the people that lived in his community, it just was, you just the mental image of what you think it looked like is terrible. I can't even imagine like the people who actually showed up and are handling that situation. It really helps me to empathize even more with what you guys do. And then just the more recent one was a lady I had seen on and off for probably around 8 years. Like at that point, they're just part of your family. You know their family, you know their kids and their birthdays, and you have so many conversations with them, and when it's unexpected, it really just does break you up,
And I'm
and
sure
it's really
EMS talks
hard.
about this too. Kevin, I know you had talked about this before, but a lot of times when that 911 comes in and you send somebody to the hospital, you really don't know what happened to them after that. Like if they don't end up coming back home, do you ever get like an update or how is that? Yeah, well,
For
Kevin
us, do
too
we
can
get
chime in
updates, or
on
you're
this, but like
asking?
EMS providers, when they drop a patient off the hospital, they don't really get like an update on like what happened, did they die, whatever. How does that work in home health? Like, do you know what happened to that person?
So normally when they are on service and they go into the hospital, usually we get the referral back when it's time to readmit them. We do a resumption of care visit to redetermine what their needs are. They might be on service for diabetes and CHF, and then they have a fall and they have a hip replacement, and now they're coming back. We need to reevaluate for PT, OT, CNA services, that type of thing. So normally we do get them back, especially once they've built rapport with you, they want to go wherever you are. So unless they're outside of like an insurance change that they're not in network anymore, they usually do come back. But ironically, speaking more from the paramedic side, in the recent situation where I had lost a patient, the EMS that showed up was just absolutely phenomenal to help get her to the hospital. And I actually made a video about it, and we actually got connected. I didn't know who they were. And it was like the one time I didn't write down their unit number for documentation purposes. And he's like, "Oh, I thank you so much for the kudos. From what I was told, like basically good outcome without violating, HIPAA and what have you." And I was like, "Oh, by that point, she had already passed." And so I think that, sometimes in EMS, you guys probably do get updates, but, you know, whether it's right or wrong, I think that it may even be better to not get updates. From some statistics I've read, the outcomes are not good. So I think knowing, in a sense, is a burden. Correct me if I'm wrong. So I don't know that that would necessarily be
Kevin,
something you would always want to
yeah.
know.
I can definitely say that there have been times when you're calling for an update that you're pretty hopeful and you think this is probably going to be a positive outcome.
Yeah.
And I would say 9 times out of 10 that happens, but that 10th one is the one that gets you. And then coming from like 911 EMS, where you kind of had the choice whether you called the hospital and followed up. In our area, we have, open lines of communication with the hospital, so we can always call and follow up. But coming to critical care pediatric medicine, those were really rough because being in a larger hospital system, you always had access to the patient's charting and you always had access that we could do follow ups. And some of those follow ups did not go like you wanted them to. And it was really hard to know that you put in so much work, so much effort, and so much time. And also, because we're part of a hospital system, we befriend the nurses, we befriend the staff, and to watch them as well be broken about losing a patient that you worked on so hard is really can be really draining if you allow it to be. Naturally, it is going to be draining, but you can limit that as much as possible through some resilience techniques. But it's not always a good thing to call and check. I've definitely had some that you think are going to go well and you call and they're like, "Oh yeah, they died a few hours ago." And then they sound so nonchalant about it,
Because
when
they
they
don't know
say it,
them. Yeah.
and you're like, "Yeah."
Right.
Especially if it's a regular. That's one of the ones that got me. Somebody that I had picked up on the ambulance for years for chronic high blood pressure and heart problems and all the, I call it Delta disease. Everybody down here in the Mississippi Delta always had heart disease, some type of heart problem or
And
heart
on
disease,
dialysis.
diabetes and hypertension. So I always called that the Delta disease, and usually on dialysis. So you'd pick them up at 911 calls and you take them to dialysis.
But so Andrea,
Yeah, but those are always rough.
as a home health nurse, I know that struggles with coworkers might not be as prevalent, but as far as like, have you ever had an instance where you had a personal conflict or like a family conflict with a patient and you had to keep them on, like a little disagreement or something that every time you went to their house, it was like, oh,
Absolutely. And that you wouldn't think there would be many disagreements with among each other, but there are. You're not necessarily interacting face to face with them, but it's one reason why I prefer to follow my own patients, because like we mentioned earlier, there are some people out here that just do not care if they live or die. Like they're going to show up, they're going to do the bare minimum, and they're going to leave. And trying to be the next clinician after them is really challenging, especially when, if I show up, I don't really know their baseline, the documentation's not that great, and I do have to call 911. Then I am the idiot who's saying, this is my first time, I've never seen them, the plan of care isn't here, I don't have their medications right in front of me, but fortunately, we usually have pretty good reception that we can access that on our phone. But it does come into play where, the quality of the clinicians coming before or following your patient. If I want to take vacation and I want someone to follow, trust and believe I'm going to be asked for a certain nurse by name to follow my patients. So that does happen. As far as with patients and family members, yes and no. So if it's something minor, we can usually talk to them and work it out, whether it's, they just refuse to put their dogs away, or if they're just disrespectful. And I've had ones where it's like they just are super disrespectful, but it's like it's not necessarily impacting patient care. So it's like I can handle this to a point. But there's been other situations where like it's over the top. Like if you say things, if you touch me, that's it. I'm not coming and no one's coming after me. You're on another agency. And that's how I was as a director too. I would not put up with, there was such a zero tolerance of any of that. And unfortunately, a lot of agencies don't necessarily feel that way, especially if you're straight Medicare. If you're straight Medicare, you can get away with sexual harassment. You can get away with verbal abuse, throwing things, all kinds of things, because that's where the money is. But so a lot of agencies don't necessarily handle it as assertively as I felt like I did. I don't care what the payer source is. I don't care who you are. I don't care that you are a top surgeon in this city. You don't say that to my nurse, and then we come back. So absolutely not. So we, unlike the hospital where you guys can't like wheel them out and be like, bye, we can let the doctor know we will not be going back. It's on you now to send a new referral to a new agency or what have you. And that has happened more times than I would like
But
to
also,
say
nurses in the
in my
hospital do
career.
not realize how lucky they are, because when I go to work, it is very unlikely that I will see the same patient the next week. So you may have to put up with them for 1 or 2 days, but they're not going to be there for a long amount of time. And you just said you had a patient that was on the service for a year or longer, that how do you like if you have a disagreement? I mean, like, do you send another nurse? Like, if you can't get past it?
You can certainly, and if I open a patient, meaning I do the initial admission, I can let I work for multiple agencies. I can let any of the agencies know I do not want to follow this patient. And usually it kind of stops there. It's like, whatever, we'll just find somebody else to do it. Sometimes they'll ask why, and certainly if it's like a safety concern or like don't send a female type thing, I'll delve more into it. But you can really at any point, even mid episode, if I've seen them 5, 6, 7 times and they still have several visits left, I can say, yeah, please reassign to a different nurse. So that does happen. Fortunately, that's pretty rare and people are pretty, respectful and happy that you're there, but it does happen. But I think that we have a greater ability to address that in a community setting than in
I
a
know we're getting off
hospital,
topic. I
fortunately.
promise, Kevin, I will get back on topic in 2 seconds. I just want to say one word that I have to say while we're talking to a home health nurse, okay? Roaches. Swear to God, I'm a
It's
princess.
real.
I'm an inpatient princess, okay?
Absolutely.
If I saw a roach on my patient's bed, I've seen bed bugs on a patient's bed that I guess nurses or didn't know what they were and they overlooked them and we had to do a whole decon of the room. But if I saw a roach on a bed while I was trying to do wound care, I would lose my ever loving mind.
Michaela,
Yeah.
I have walked into houses and the walls are
I'm not
moving.
meant for outpatient
Yes, it's
nursing.
real.
I'm not.
There's
Well,
ways to address that, you precautions, and you kind of know the first time you go in. And sometimes, we kind of have to judge the information that we have, the outside of the home and things like that too. So you're wearing a certain type of shoes that have been baptized in, you know, bug repellent. But I've done many visits with wound care. I've done wound vacs with my full backpack zipped up on my back. And I don't sit down. We put barriers underneath everything that we're using. We only put our bags down on flat, hard, clean surfaces. But there have been instances, if we know that there's bed bugs, we immediately leave, and then we do not come back until they have a purchase order from a pest control place that they took care of it. And that has never happened. We tell them that we require that, and we never hear from them again. So they're probably
Not for
still there
me.
with the bed bugs. There have been some instances where patients have had bed bugs, and if we know, we show up in full PPE, and we might do the visit on the patio, but we're not going in, and it's a whole protocol and everything for that. But it's very real, especially here in Las Vegas, especially when it gets hot. We're getting roaches, we're getting ants, we're getting spiders, things like that. So that's legit. And they'll just be chilling in the bed with the patient, and they roll over and they
A
hurry to
lot
find
of
their
just
warm spot
normal
again.
lay people. Kevin's like, we're going off on a tangent. I get it. It's part of healthcare, Kevin. But a lot of just lay people don't know.
No, I'm
Flashbacks.
having significant PTSD
She's leaving you up
flashbacks.
there, Kevin.
I don't even care about the topic. I'm thinking back to Mississippi Delta hot, humid summer night kind of environments, and it's just
You start to when you see it, suddenly your ankle itches and you feel like it's something there, or you're something on your arm. You just start to have these phantom itching, and it's those are the quickest visits, and you take in the bare minimum with you. But yeah, it's not common. I'll say I don't think I have any patients right now that are quite like that, but it definitely does happen.
What if you had to tell the normal layperson or healthcare professional, what is the number one thing that you think that you would want people to know about your profession as a home health nurse?
Probably kind of a little bit what we talked about, which was the significance of the environment. People underestimate the impact of that. Everything from safety concerns and dangers, because we don't know what we're walking into. And there's been cases of people being injured, held against their will, murdered. So that's a very real concern. This related to the environment, and just how difficult it is, or how challenging it can be to provide care in those environments, whether it's wound care, whether it's, I have put in a Foley where a cat jumped over my sterile field, so it's just things that you can't even imagine related to the environment. That's probably the biggest thing that I
And
think people
what is one
underestimate.
thing that you think you would tell a new home health nurse to protect her mental health or his mental health?
I would say to have clear boundaries of what you're willing and able to do. I think the industry, regardless of whether it's home health or not, there's implied rules that you're supposed to give everything that you have and more for the sake of the patients, for the team. I hate hearing that, for the team. And so whatever works with your lifestyle. For me, I don't work, with very rare exceptions, I don't work weekends. I don't work nights. I don't answer my phone very rarely after I get home. I don't work holidays. I take regular vacations. I don't see more patients than I can handle. I don't take on more. And so I think for new nurses, they are in that bubble of nursing school where they are meant to go out and really try to prove themselves. And so they, I think, in a sense, are taken advantage of by management and administration asking so much of them. Just, can you take on one more patient? Can you cover this shift? Can you do on call? Can you do this? And they feel a certain type of way about saying no. But it's okay to say no, but you have to say no early. Once you've established that precedent in the beginning that you will, it's so hard to backtrack and no, I don't want to do that. And some people have feelings about you not doing that, but you just have to have those clear boundaries. It is
I love
essential
that.
to your mental health, in
I
my
think that
opinion.
that's a great tip. In anything, in EMS, in inpatient nursing, and outpatient nursing, I think that was a great tip. Boundary setting is so important to protect your mental health because it's just a hard thing to say, but anytime any agency thinks they can take advantage of you for the same amount of money, unfortunately, they will. That's just free labor for them.
Absolutely. So well said. And I think it's a hard reality to face because you hope that if you provide a good service and you're a good person, that somebody will have your best interests at heart. You can't count on that. There might be a couple handful of people in your entire career that really are trying their best to look out for you, but it sounds greedy to look out for number one, but you have to because no one else is out here trying to do that.
Yeah, and one of the things that I think you've done really well is you've utilized your platform to uncover some of those things. Even in the early days videos where you were talking about strictly home health and things you'd encountered, it's refreshing to hear somebody that's open and honest enough to say that. A lot of times we get into this mentality of we're not supposed to show the bad side of what we do. We're not supposed to show the struggles of what we do. And I think that you've utilized the platform well. And everybody that has listened to this for any amount of time knows that I'm a huge fan of TikTok. I'm a huge fan of social media. And the reason that is because it's one of the main avenues we have that we can communicate with a large, massive number of people all at once. And I think that's, even, and I always say this, your videos and a few of mine can get 20, 30, 40, 50,000 views, but even the ones that get 5 or 600 views, if you put 5 or 600 people in a room, you're speaking to a large audience.
Absolutely.
And that's huge. So I think you've used your platform well. Do you feel like that it has helped you in your own personal journey to start to use this platform the way that you have? Do you think that it's developed something in you that you did not have before?
Absolutely. I think that you grow and heal through shared experiences. It feels validating to know that you're not the only one having a certain type of struggle. And so when you find kind of your people, so to speak, your group of support system, your cheerleaders, I guess you could say, and understanding their experience, I think that there's a lot of growth and healing in that. So that definitely has helped me along my journey to recognize some kind of toxic and unhealthy things about the careers that we're in, but also better ways to kind of cope with that and deal with that.
That's a great answer. And one of the things that I ask almost everybody on the show in some way, shape, form, or fashion is what are some of your non-negotiable mental health exercises, habits, whatever you want to call them? What are some of those things that you do to keep yourself grounded and in the right direction?
What we already talked about, and for me, with the strictness of my work schedule, I'm very picky about where I spend my time. And like I said, I'm not going to, with my family dynamic and the circumstances, and I've got two adopted 2-year-old boys, so that is a very different situation from someone else. So my boundaries are going to be different. So, my weekends are going to be prime time. My evenings are going to be prime time. So I have, set boundaries for my availability to my employers. I give 110% when I'm there, but you don't own my off time, respectfully, of course. I think also it's important to recognize who you are without the title. You need to know that. You need to be with it. Stripping away all the letters after your name, it's important to know who you are and what gives you purpose in your life, and to constantly integrate things that support that into your life so that if, the title and the job goes away, you still know who you are. You're still a valuable person. You're still loved. You're still important. And so integrating those things into my life, having my support system really strong, my strong network of cheerleaders, those are all kind of my non-negotiables. Those are going to be a part of my life to the best that
That's so
I can
sweet. We talked about that
do
with a
or
note
have them
from
in my life.
Dad. He said the exact same thing. That is so sweet.
Yeah. Yeah. You're the second person today that I've spoken with from Las Vegas. I don't know if you know Medic Mike.
We're like my BFF over here. Yes, 100%.
He's going to be on the podcast later on. We finally set a date today and finally got to connect. He
He's
was
gonna
just the nicest guy. He was just so nice. But apparently it's a thing with Las Vegas people that you guys are just overly nice. I thought because I was in the South, it was us, but
No, not at all. Mike, he's amazing. He's a firefighter, paramedic here, but he does so much for mental health in this community, talking to different groups, especially new and upcoming people in EMS, talking to them very frankly about, risks to their health, risks related to, suicide and addiction and that type of thing, and how to go into the career and have good coping mechanisms and utilizing your resources. So he's making waves over here for
Oh, I
sure. So
can't
I'm looking forward
wait.
to that podcast for
That's
sure.
awesome. In one of our closing questions, Andrea, just for my personal knowledge, what does it look like to fill your own cup up? Do you like long baths? Do you take walks? Do you like to go on vacation? Kind of what does that look like for you?
Michaela, it's not a dating website. Calm down.
Long beach. I don't know. I get cold easy. The beach is always cold for me. That's a good question. I'm finding I'm very extroverted, but when I'm not, like I really just value alone time to decompress, to reduce the stimulation. So having just some time, a little bit of time every day just for me, which in home health is kind of nice because it's chaotic and you're dealing with a patient, but then you have like 10 minutes or however many minutes of solace in your car until you go to the next one. So having little spurts of time just for myself, but also having a really strong support system. Like Mike, actually, we're like the biggest cheerleaders for each other. Like he texted me the other night, it was like 10:30. He's like, I reached 1,000 followers, and like you just have like a dance party like right then. So making sure to have the cheerleaders in your life very present, having the conversations with them, having that downtime to yourself is really important. If I had more time, now I did mention I've got 2 toddlers, so that's always, being pressed, but I think reading is a really good way to, educate yourself, but also kind of escape a little bit. So I would like to have a little bit more time for that, but having my time for myself and just being really choosy about where I give my time is very important for me.
Well, I'm going to need you to come back on the podcast eventually because you're going to have to teach first responders how to do that because we're very bad at not enjoying to be alone with our own thoughts.
We're gonna
And
about it.
yeah, I could do a whole episode on just that. And apparently, I want everybody listening to this to pick out something that Andrea said that has been mentioned in the last 4 episodes. So I know somebody needs to hear it because she's the 4th guest that's hit on it in a row. Do not lose yourself in the identity crisis of I'm paramedic Kevin, or I'm nurse Andrea, or I'm nurse Michaela. Like, you are more than your title. You are entitled to be more than your title. And that's a strong, strong message that everybody has sent the last 4 episodes. So apparently it's one of those things that somebody needs to hear. Andrea, tell us where we can find you. Tell us what next projects are for you. I know just recently you did a few lives to discuss mental health and things like that, which were great. And hopefully we can collaborate on that some more.
Yeah. So primarily on TikTok at Nurse Andrea Law, also starting to get into kind of Instagram a little bit. As far as new projects, I am working with an amazing group that have been hand chosen on TikTok to kind of work on some projects related to mental health that will be announced probably over the next few months. So really excited about that. But yeah, I totally agree with you that there's a theme of knowing who you are. If you can't sit down and write a full page of who you are without mentioning anything about your job, you have a problem and you need to fix that. So for anybody who's listening, if you can't immediately do that, sit down and write down who you are, then you need to do that today.
I do appreciate you being here. Thank you for joining us. If you ever need anything from us, we are here and available. Loved your interview. This is going to be so much fun to edit. So that's my other favorite part is the editing process. You get to go back through and listen to everybody talk. So that's fun for me as well. So as always, as we close the show, we say the same thing every week. You can find us on all the social media platforms, YouTube, Facebook, Instagram, TikTok, of course. We recently had one of our videos. I had the Happy Mike dance that you described because one of our videos hit like 28,000 the other night, and it was like big deal.
Awesome.
But as we say every week, be safe, take care of your mind, and we'll talk soon, everybody. Thanks for joining us, Andrea.
Thank you so much.
You've been listening to A Silent War Within. If this episode resonated, please subscribe, leave a review, and share with someone who needs to hear it. Remember, you're not alone and your well-being matters. It's time to end this silent war.